All right, guys. So, um, America's Choice is there's a couple different health plans behind it, and that's what I'm going to go through with you. But just so you understand, America's Choice is just a brand name. Okay, there's a couple of very important organizations that you need to know about that are behind the plan. Right, first one is Detego Health, Detego, Detego Health. They're the TPA in the plan sponsor. Okay, so they're going to be paying all the claims, processing all the claims, doing our customer service, which they do an amazing job of, and those sorts of things. And then the other organization, because this is a fully insured plan that you need to know about, uh, is Granular Insurance. If you are not familiar with Granular, you can look them up at granularinsurance.com. They're the fastest growing stop loss carrier in the nation. They're an A-minus rated organization, and their largest shareholder happens to be Alphabet, or Google, as most of us know them. All right, so there's a lot of money behind the plan. And the way this whole thing started, quite honestly, guys, is in the plan's been around as a group plan for a long time. Okay, and in preparation for what we're looking at now and law changes and those sorts of things, we thought it would be great to bring this down to a group of one. Okay, and that's exactly what we've done. So we can sign up individuals and their families, and that's where this plan is marketed to. So we spent about a year putting this together on the individual side. We've been launched for just about a year on the individual side. It's going exceptionally well. There's 30 to 40,000 people on the plan on the individual and business owner side, and the plan is functioning exceptionally well. So what we're trying to do is to fill a void that's met by what's out there, right? So we have coverage for our employers, okay, and then for the individuals and small business owners, we're looking at ACA, health sharing, short-term medical, and limited med. A lot of those short-term medical plans that a lot of us have serviced our clients with over the years, we know they go away in September, so there's going to be a tremendous void in the market. And limited med, they're kind of targeting that as well, so we don't know exactly where that's going to go. And what we have the opportunity to do here is to offer something that is it's a step above everything that's been in the market. And I say that, guys, I've been licensed to sell insurance for 31 years. For the last 21 years, I have been selling individual and small business and small group health insurance. This is the most excited I've been about a plan in at least a decade. It is compliant with the ACA. Okay, so that does not mean it's an ACA plan. It is not. There's no subsidies available and those sorts of things, but it is compliant. So when our clients qualify for this plan, they are fully with either any of the plans. They are fully compliant with the ACA rules and mandates. The plan is available in 44 states, so it is available everywhere. I'll give you the exclusion states. It is available everywhere except for California, Washington, Oregon, Hawaii, Vermont, and New Hampshire. Every place else we sell this. So if you've ever had anybody ask you in New York and New Jersey and Massachusetts, those typical northeastern states, we absolutely positively are doing a great job having coverage there. Okay. The plan is designed for the self-employed. All right. So those are the people that typically don't have access to group benefits. Okay. People that work in the gig economy or have a traditional self-employed. And when I say self-employed, whoever joins the plan has to have some sort of self-employed income. And that could be that they started a business and they don't have revenue yet. They could be working for themselves for a long time. They could drive Uber once a month. They could invest their money and have a 1099 at the end of the year, whatever it is, there's a whole bunch of definitions for self-employment, so it's not really hard for us to qualify. And we can write these people anywhere from 18 to, until they age into Medicare. All right. We have two different networks that you're going to see on the plans. But what happens is this, okay? Everybody's going to join an organization as part of being part of the plan called Population Sciences. Population Sciences is a data company. And so when our clients do things, they aggregate that data as a whole. So no one client is ever going to be singled out or anything like that, but they're looking at the data and what that means from a healthcare perspective. And the beautiful part of that is our clients are actually becoming a working owner. They're going to get a check at the end of the year, somewhere probably, from $1 to $100, nothing with any significant tax implications. But they can do more, do surveys and things like that if they want to earn more money from Population Sciences, but they don't have to, okay? Gig Care is the name of the plan group that uses the Blue Cross and Blue Shield Blue Card network. So one of the plans that you're going to see, plan groupings that you're going to see today, uses that amazing network. We have unbelievable coverage nationwide. Now, I said one of the plan groupings. There's really two types of plans. There's what we call annual max plans, and there are metal plans. Okay, I'm going to go into the annual max plans first, and then I'll go into some detail on the metal plans. But what an annual max plan means right now is, yes, there's a maximum per person per year. So the 500 plan is the one that we sell. We don't really sell a bunch of the 250, but what that means is our clients get $500,000 worth of insurance per person per year, $2.5 million total on the plan. And the way the plans work has been going exceptionally well. So what happens is this: our clients go through the application process. All they have to do is answer some medical questions. I'll show you in a second. Then they will get an email welcoming them as long as they pass the medical questions. They get an email welcoming them, and they will get access to their personal health dashboard. When they have that access, there's a whole bunch of things that they have access to. So they will have access to different coaching and dietitians and those sorts of things if they want to use it. The biggest thing, in all honesty, that our clients use the personal health dashboard for is two things. Actually, they use when, it takes 7 to 10 days for them to get their cards, but they have access to their soft card right away. So they have a digital card available to them. And then they can view all of their claims in their personal health dashboard as well. So on top of all of these different things that are offered at no additional charge to our clients, the biggest things typically are that they're going to review any claims that they have on that dashboard, and they'll also have access to their digital card before the hard card comes in the mail. And the hard card, guys, is a beautiful hard plastic card. It's actually better than the United Healthcare group card that I carry. So it looks extremely professional. And to get on the plan, these are the medical questions, okay? So as you scan them, you will see that everything is pretty major. Have you had a heart attack, stroke, cancer? Have you been treated for those things in the last 5 years? But here's the big one, okay? The big one is, if you've had some sort of surgery and you have been medically cleared, so I had knee surgery 12 months ago, I got medically cleared 3 months ago, no more therapy, I can get on the plan. And here's the beauty of it: there are no pre-existing conditions, exclusions, limitations, waiting periods. There are none on the plan. So if our clients can answer no to these questions, there are no limitations on the coverage, like we have seen so many times in the individual space, right? If I had that same knee surgery and I went on a short-term medical or a fixed benefit plan, I had to worry about not hurting that same knee because the pre-existing was not going to be covered. If I'm on this plan for 30 days and I blow out that same knee, they're going to pay for it. That's a huge deal for us. And as agents and brokers, it lets us put our head on the pillow and feel really good about what we're selling. Let me, just want to make sure. Okay, I was just checking the chat there. Okay, so the way the annual max plans, guys, work is they have 100% of the preventative services for the ACA. So all 64 MEC mandated products are covered. So your client's physical associated testing, mammogram, pap smear, colonoscopy, that's all going to be free. Okay, for the big stuff, what I've done is I've put a little slide in here just to kind of give you a snapshot. So on this plan, we got a $500,000 on the plan. Now, where the limitations come in is if I get sick and go to the doctor, any doctor, specialist, primary care, urgent care, it's $50, but I only get 10 visits a year. After that, I need to have I'm going to pay the network discounted rate. On these plans, the network is the PHCS Ancillary and Practitioner Network. Okay. Um, the patient is $1,000 copay, and then um, they pay 100%, but for the next 10 days. Okay. Now we know that 97.5% of all hospitalizations are 3 days or shorter. But can it happen? Of course it can. Now, the organization will negotiate on behalf of our clients if it goes over that 10 days, but our clients get 10 days per hospitalization. And you'll see that maternity, our clients get pregnant, they're going to pay $250 on a global bill, and that's all they're going to pay, or $500 if they have a C-section. All right. So the plan itself is really easy to sell. It's rock solid. It gives our clients what they're looking for. One thing that not all people are used to is if you're not familiar with reference-based pricing. Reference-based pricing is what the methodology is for hospitalization and surgery. So reference-based pricing is based on Medicare. Okay, so if a procedure happens and Medicare pays $1,000, reference-based pricing typically pays a multiple of that, so 1.5 or 1.8 times of Medicare. These guys have the authority to go up to 4 times Medicare, which is actually the highest I've seen on any plan. So all our client does is if they have a scheduled event, so let's go back to that knee surgery. They have a scheduled event. They go in and they call and get pre-certified, just like I have to do on my United Healthcare group plan, 72 hours before or more, and then the insurance company takes it from there. So they'll call the facility, they'll work out the payment and the pricing. Our clients go in and have a seamless event. Now, if there's an emergent event, so some sort of emergency, big or small, there's no pre-certification necessary. It's only on scheduled events. And on the right-hand side, guys, you can see the power in this thing. There's no age bands on this plan, okay? And a family is $929. So if you have a 55-year-old family of 4 in Georgia on an ACA plan, it's probably $2,500 a month. And on this, it's $929, okay? Those are nationwide rates, and they are not age banded. Incredibly strong. Now, the pharmacy on this plan to keep the pricing down. So the pharmacy is set up for anything acute. You go to the pharmacy, and then for our ongoing maintenance medications, they want you to get set up for mail away. Okay, so they'll give you, obviously, you get on the plan, they'll give you the first prescription, the first month at the pharmacy, but then they want us to get set up for mail away, and that's how this America's Pharmacy source works. Any questions on the annual max plan before I move on to the metal plans, guys?
If you're trying to talk, you may have to unmute yourself there.
All right. If there's no questions, I'll just keep going. Guys, the metal plans, as I mentioned before, these are full ACA compliant metal plans. Okay, so again, all of the wellness that you would see covered on any ACA plan, you have a maximum out of pocket. The maximum out of pocket on all of these plans is $7,350. So actually lower than the ACA. We've got our national PPO networks to choose from, okay? And the metal plans are on a different formulary. They're on something called Medalist RX. So it's a richer formulary that allows even those maintenance medications to be done at the pharmacy if you wish, okay? But it does have, it's got a much larger formulary on the plan. Now I've put a snapshot in here of what the plans look like because it's super simple. All your wellness is covered. You have some sort of a deductible. It's 80/20 co-insurance up to 7350 unless you choose the 7350 deductible, then it's 100% co-insurance. There are no limits on the plan. Okay, so you'll see the doctor's visits have no limits, the specialist visits have no limits, and there's no limits on the amount of money somebody can spend on any hospitalization. It is truly what you would think of on an ACA plan. Okay, everything else, guys, just like a true major med, is going to go towards that deductible, whatever you've chosen. Now, when we talk about that, well, the first thing that people ask for is, well, how much does it cost to have a national PPO network? So I've put some pricing in. You will notice that these are age banded. So this is the 18 to 44 age band. So all the way up to age 44, our client for the 7350, which honestly is the most common plan that we sell, is under $500 a month. Okay. Now, as we get older, the price does go up, but it's not. All right. So we went from the 500 to 512. A family plan from the ages of 45 to 54 for $1,260. So pricing is incredibly competitive, okay, right across the board. And this is the oldest age band, okay. Now, we also do have HSA plans. Now, these used to be huge back in the day, before the ACA, and the ACA kind of killed them, but I love an HSA plan. If you're not familiar with what an HSA plan is, relatively simply, your wellness is all paid for like you're used to. Everything else goes towards the deductible. There's no copays. Everything goes towards the deductible. And the thought process there is that you can set up an account, an HSA account, and fund it with whatever, with money. There are certain limits for individuals and families. But that money is a 100% tax deduction. It is honestly the best legal way to launder money in this country. And that gives you the ability to use those funds to pay for everything up to your deductible and co-insurance. But because of that, those plans can be a little bit cheaper, but because there's no co-pays. And those plans are still ACA compliant, all right? And you can see that at that lowest age bracket, it saves our client about $50 a month, okay? And that's pretty consistent across the board. So it's $50 cheaper for a 5,000 HSA than it was on the 7,350 with copays. So it's a great option for a lot of our clients. And these also carry a 7,350 max out of pocket for all of our clients, okay? These are just some of the different age bands. Now, I mentioned to you guys earlier that we have something called gig care. Now, gig care is essentially, they're the same plans, ladies and gentlemen. It's just the brand name that they're using for the plans that carry the Blue Cross and Blue Shield Blue Card National PPO network. Okay, so we've got HSA options. We've got the same copay options. There's no reference-based pricing. It's just a national Blue Cross and Blue Shield PPO network across the country. So everybody that takes Blue Cross, they get a really pretty looking Blue Cross and Blue Shield card, and they take that any place that they want to go. The prescription formulary is also with My Prime, which is a Blue Cross and Blue Shield organization. So everything happens on gig care, everything happens under that Blue Cross and Blue Shield umbrella. Now, our clients do pay a little bit more for that. Okay, so you can see that this is the this is a different age band, but it's 18 to 29 age band. So the 7350 with 100% co-insurance is 569 instead of just under $500 a month. But what we have found is two things. Number one, a lot of clients just want that brand name, so we give it to them. And some of the clients just have an awful lot of comfort knowing that Blue Cross and Blue Shield, after doing their due diligence, would jump on board with the plan because it took a year, and they have dotted every I and crossed every T. And so some of our clients, just knowing that Blue Cross is involved, they'll even choose the other network, but just feel more comfortable, even though it may be a plan that they haven't heard of. Okay, that takes a lot of that consternation away from our clientele. Okay. And then the biggest thing for us guys, and I'll let Rick talk about this, but the biggest thing for us as brokers is number one, the clients are thrilled and the plans are working exceptionally well and the service is great. So when our clients stay on the books as they are, right now we're running at 92% retention. That matters even more because the compensation is level. So I'm going to make the same amount in month 3 as I'm going to make in month 30, as I'm going to make in month 60 if my client's still on the books 5 years later. So myself, my agents, we're truly building an annuity that's going to stick with us and keep paying us. Every single time I put somebody on the books, I have just put a steady revenue stream on instead of having, if I'm selling a traditional, whatever, fixed benefit or short term, and the numbers go down in year 2, or on an ACA plan where everybody's stealing our book of business from behind our back and nobody cares enough to fix it. All of these different things have gone away. All right. So with that, I will open it up for questions and comments. And I'll check that chat now as well.
Yeah, I've answered a few of the questions in the chat.
Okay.
Someone wanted to see the old, I think it's a 55-year-old band.
Okay.
Mary wanted to see that.
55 to 64 right there, that one on the gig care, or did you want to see the PHCS?
Mary?
Yeah, that one looks good. She's 60 and on ACA with no subsidy and paying 1,800 a month. So I think she's gonna really like this.
Just for her, right?
Just for her.
So think about that. Now that's
Right.
just it's a great example because that person is probably on an HMO plan
Right.
with a 9,000 plus out of pocket. She can't go anywhere and get her coverage, and this is a national PPO with a 7,350 out of pocket, and it's half the price or less.
And she's on Blue Cross Blue Shield, so yes,
And so she gets to keep her network.
she will like this.
Yeah, one other thing, Mary, you can actually put a gap in this, so you can use Philadelphia and add a gap with this. And you
Right.
limit that deductible if you wanted to do that. Also, from experience, you probably know that very seldom does anything cost more than $500,000 in a calendar year. So those other plans that you looked at, they would save even more money if you went with one of those.
Right. That's actually the one I was wanting to see, the 500,000.
Pardon me? I'm sorry?
That was the one that flashed by real quick, the $500,000
Oh,
plan.
yeah. Can you go back to that to the $500,000?
She
To
just
this,
called me
Yeah,
yesterday.
the rates right there. See the rates is $479.
Yeah, that's great.
Yeah. So let me show you guys some commissions and I can also show you that this is a GA contract, so you will be able to recruit and train other agents and receive override as a result. Just to let you know the contract that you will get. Let's see, how do I do this? All right. Okay, some of you may not be familiar with National Group Marketing. This plan is still with National Group Marketing. And so here's what my back office looks like to give you guys some idea. And as you can see, it has the Blue Cross Blue Shield network. Of course, these two here use the PHCS network, which is a very large network also. And here's some of the deductibles and some of the plans, etc. And let me open one of these up so you can see what it looks like. So you want some more info. This gives an overview of what the plan covers to your client. We've got a brochure here. This is what your back office is going to look like. We've got summary of benefits. This is what I originally showed some of you. You saw this summary of benefits right here. And you're going to get a copy of this, everybody. And here's your PHCS network, okay? And some people in here from Idaho. So I'm curious because I really don't know the market in Idaho. Can someone in Idaho give me a zip code, please? Hello? Somebody in Idaho?
83646.
I'm sorry, say that again.
83646. Yep. Meridian.
Okay, and I'm just going to put, again, I'm not familiar, so I don't know what's going to come up here. Okay, so these are all of the doctors. Oh, here it is, 139 doctors within 20 miles of that zip code. So this is to show you how far away that doctor is from the zip code that you gave me on the right-hand side over here. Okay, so we've got quite a few doctors in Idaho. Is it
Can
any?
you choose hospital on that again?
I'm sorry?
Curious what the hospital looks like. We have two real competing hospital systems. Which hospital?
Okay, how do you
So guys, on the hospital, so remember this, okay? This is important. I'm glad you brought that up. So on the Blue Cross plan, it's a typical search, okay? But on the reference-based pricing and PHCS plan, there's no technical hospital network because it's anybody that accepts Medicare, which is essentially all of them. Okay, so they will call and they will work each case with the team. I mean, so there's a team in Cleveland, Ohio of 130 people and a team in Omaha, Nebraska of about 90 people. And that's all that these guys do, okay, is if we have a procedure, they will call, they will work with the hospital to get that set up.
Are you
Sometimes,
balanced?
oh, great question. So first of all, if there's an emergency situation, there's never a balance bill. Okay. If it's a non-emergency situation, they will give the client the option. They will always have an option where the client has nothing more out of pocket than their deductible. But so we had a client actually last week that had a knee surgery, and they gave the client an additional option that said if you went to this facility to get your procedure done, they would waive the deductible because the insurance company was saving so much money on it. They saved the client $5,000 because the client chose that option. All right. So that's why they ask for the 72 hours up front. And if there is not that time because it's an emergency, there is no balance bill.
Okay, there's what I get for hospitals there.
That's all of them.
That's all of them? Okay, great. Okay, now as far as commissions are concerned, alrighty. Okay, so this is the contract right here. This is what you get, and this is the plan I'll probably be selling most of right here. America's Choice Health Plan, 500,000. So this right here is the commission schedule. Over here, you're going to find this is the area producer, and this is the producer schedule. So this is the spread that you see right here. And you can put in the number of agents. So hypothetically, if you get 50 agents and they do 2 sales a week, that's $500. Or this is for the area producer. For the producer, 50 agents, 2 sales a week, you get $1,000. So this is the give, and keep in mind, these are level commissions across the board. So assuming the client keeps this, you'll get that $1,000 10 years from now, every month, assuming that the client keeps it. And of course, that multiplies on a weekly basis. So this is some of the opportunities that you would have when selling this product. Anybody got any questions?
So guys, for an individual, say on the 500 plan, you're making $90, $85 a month, $138, $146 a month on that one plan. So you sell a family plan and you're making, $1,600, $1,700 for the year. And again, you're going to make the same thing in year 2 and the same thing in year 3. And that's the key is, we don't really, take that 250 out. You won't find much use for that. You're not going to sell that a whole bunch. It's really going to be those metal plans on the top and the 500 plan on the bottom.
You just messed with this a little bit. Oops.
You say you have filed this in Idaho and it's approved?
It's in every, it's in Idaho. It is in 44 states. Idaho is certainly one of them. Now, guys, this is ERISA based. So this is a national plan through the Department of Labor. Okay, so it's not each individual state filing like what traditionally we are used to.
What states it filed in?
Yeah, let me interject just a little bit here. ERISA means Employee Retirement Income Security Act of 1974. Okay, so I don't know if anybody here sells level funded plans or self-insured plans, but those are filed under the Department of Labor. So they're not subject to Health and Human Resources as far as their mandates are concerned. So that's what we're following here. That's why that was the biggest thing I was trying to understand. Until as soon as they said that this was an ERISA plan, immediately I understood exactly what was going on. So I don't know who sells maybe United Healthcare level funded plans, but
yeah, they're old. It was called All Savers and
yeah,
all states level funded plan. It's the same chassis.
Same thing. So that's why you're able to sell this year round. It's not a trick or anything. It's just that it's under the Department of Labor. So anytime you're dealing with employee, retirement, income, and security, Social Security, that's when you're going to find the Department of Labor steps in and actually manages this as opposed to Health and Human Services. So this does have those mandates behind them, and it also has the 10 essential health benefits with it. So it must still have that. So just to let you know, it does keep those mandates as far as the 10 essential health benefits are concerned. So under that $500,000 plan, a maternity, there is no deductible for a delivery there. I know I get that a lot. Matter of fact, I've got a couple of clients now looking for something that's affordable for maternity. I think for a husband and wife, I think it's like $679 total.
So on the maternity, since you've got, what happens after 10 days? If somebody's hospitalized, take maternity out of it. Let's just talk in general.
Yep.
If somebody's hospitalized for 10 days, we know it never happens, but that's when it happens.
Right.
They're in the hospital for 14 days. Let's just use COVID as an example. Somebody ended up, nobody saw that coming where somebody might be in the hospital for 18 or 30 days at a time. What happens after 10 days?
So when the final bill comes in, they will use their knowledge and expertise to negotiate the best they can. So they will have this big pool of money that is allotted for that client for that first 10 days, and they will do everything they can to get that bill as low as possible for the client. It does happen. My team has 4,000 policies on the books. It hasn't happened yet for us, But you're right, it absolutely positively will happen. And so for us, it's incredibly important that we make sure that our client know that up front because, you know, our client's going to make the decision that's best for them up front. Because if they're looking at either an ACA plan or even one of these metal plans and they just can't afford it versus the 929 for their family that they can, they do have to know what the risk is, but people are still making that choice. And as long as we educate them, and I would never hide that from my client, but most of my clients are going to feel very good about it. And even a larger percentage than that are never going to run up against it. But if they do, the negotiation will happen at the Datego level and they will do everything they can to bring that down. The other option on that, you know, is additional supplements, you know, depending on what the budget is for those clients. I am a big proponent of selling, you know, additional critical or accident. But again, you know, we're just trying to educate and protect.
And that's per occurrence, or is that,
Yes.
okay? Maternity, let's go talk about maternity. You got two events that take place. You got mom having a baby, and then you got the birth of a child. Two deductibles, or I guess you're calling it a copay. Mom pays a copay for her facility charges and her billing from the primary care physician, or
Yeah, so everything in a typical maternity bill, whether it's this plan or any other, is done on a global basis. So somebody goes in, they determine that they're pregnant. That visit is separate. Everything going forward now is done as part of a global bill. So the sonograms and the doctor's visits and all the follow-up is going to be part of that one bill. Our client is going to pay $250 for that, including the 3 days in the hospital after. They will have to add that child within 30 days to add the kid to the plan. But there's not an additional 250 for that child. Everything that happens as part of that event will be covered under that 250 or $500. Once they leave the hospital, then the child will have, you know, their own co-pays and those sorts of things.
mm-hmm.
And guys, if you have any additional questions in the meantime, send them to Rick. He'll get them off to me if he doesn't have the answer, and we'll make sure we get those answered for you so you feel comfortable. I will just tell you that the experience on our side from an agency perspective has been honestly second to none. They take care of our customers extremely well. They answer all of our questions in a timely fashion. And quite honestly, everybody's making a bunch of money, which doesn't hurt.
Well, here's my email address, guys, in case you don't have it. Rick Thornton at insurancetodallas.com. Hold on, I got something in the chat here. Let me see what this is.
Yeah, you mentioned at the very beginning that there's data sharing.
Yep.
And that the customer could share in data and be paid something. Can you elaborate a little bit more on that?
Sure. So our customers are all becoming what's called a working owner at Population Sciences. Okay. Population Sciences is the data aggregator in the background, and this whole thing sits on their platform. So to be on that ERISA plan, a single plan for all these individuals, we have to have them part of a group. To keep the plan fully compliant, they all have to be employees. So they are, okay? So they're becoming an employee, a working owner of Population Sciences. So what happens is all of our clients are getting 3 shares, and they're everybody's going to share in the profit at the end of the year. Your client will actually get a check and a K1. It won't have any tax implications. It'll be a small dollar amount. But that is honestly, Steve, for compliance and to make sure that, you know, the plan's here for the long run because everything is done properly. Now, as far as the data goes, you know, when they go to the doctor and if they use any of the other services, without their name, all of that is aggregated, how many doctor's visits are used and how many people actually partake in, if somebody uses a dietitian, what is their medical history, how does that change, and those sorts of things. You'll notice, that there's a bunch of different services. Some people may use, most people won't, but their goal here is to keep people healthy. They don't ask height and weight on the way in. They don't care if you're a type 2 diabetic on the way in. Those are not knockout questions, but they do want you to take care of yourself.
And by the way, in level funded and level funded plans, you do have health questions that you have to answer too, because I put a lot of people in United Healthcare, All Savings. I think they changed the name now, but when I do, they always have to go through underwriting first, just to let you know that.
So you've done this for a year.
Yep.
What's the renewal been like?
So on a rolling 6 months, 92.3% of the business stays on the books.
Mm-hmm.
So, I mean, look, we've been doing this for a long time. I don't get that persistency on ACA. I don't get it on short term. I don't get it on fixed benefit. We've got over 1,000 agents, and this is by far the most positively persistent product in our portfolio. And we deal with all the major carriers.
You'll send out summaries that break down the benefits a little bit more. I saw you had
100%. Yeah. So you'll see. So there's Steve. There's two types of documentation that you'll see. There's the brochures, which are made for any client to be able to digest. There's also the summary of benefits, which those blue documents we're all used to taking a look at. And if you want, the full scope is also available. So the full 100 pages of what the policies look like, we have those available for you as well. There are no secrets.